Hello, everybody. Welcome back to the channel. We're so glad to have you with us today. I hope you've been enjoying the series. Today is day 3, and remember, it's going to be 12 days talking about obesity, giving you the information you need to get on top of this, terrible thing called obesity. My name is Dr. Adaeze Ifezulike. If you're joining us for the first time, please subscribe. Even the people who have been listening, do subscribe, please, so that we can keep getting these videos done. It's really for your benefit. I am a lifestyle medicine physician, and I love to help people get healthy using their lifestyle. So this is what this is all about. So subscribe to our channel, and so you can keep informed with what we're doing. So if you haven't watched the previous videos, really important to go back and watch them because each clip fits into the other, if you see what I mean. So if you miss any of them, then there's a gap in your knowledge and you may not be able to connect with the next video. So please go back, watch day 1, watch day 2, subscribe and stay connected. Okay, so in the past 2 series, we've talked about obesity and how common it is. We looked at the cause of obesity, and we said that the major issue there is not that you're eating too much, it's not that you're not exercising. We can't just blame people who are obese. We have to look at the root cause. And we said that the root cause of obesity is raised insulin levels. Okay. And yesterday we talked a lot about insulin. You need to understand this hormone. It will help you so much in your journey. Okay, so today we are introducing fasting for weight loss. Okay. What is fasting? I know when I say fasting, that scares a lot of people, but I hope today's clip will help you understand that it's not as scary as it sounds, and it's something that is easily doable by most people. Okay, so fasting simply means the voluntary abstinence from food. That means you have food, but you're choosing not to eat. Okay, so it's not starvation. It's not like you have no food and so you have nothing to eat. No, in fasting you have food and you are choosing not to eat. It might interest you that to know that the longest ever known fast was 382 days by a 27-year-old Scottish man. I mean, I am here in Scotland. I'm broadcasting from Scotland. So it excites me to know that a Scottish man did this. He went on a fast for 382 days. Imagine that. His starting weight was 207 kilograms and he lost a total of 125 kilograms. He lived on tea, coffee, soda water, vitamins, and it was meant to be a short fast, just a short fast. But then he felt so well that he just carried on fasting. Isn't that amazing? And 5 years after his fast, his weight remained around 88 kilograms. So he was able to keep off all that weight. Imagine coming from 207 kilograms to now have a maintenance weight of 88 kilograms. He did so well, and so can you. That's why we're here to equip you, to help you know how you can do it safely, okay? And to let you know that it's so doable. I've included the story so that you know what is possible. It's unlikely that you listening to me will have to do 382 days fast. I'm sure you wouldn't be doing that. But it's just to let you know that these are things that have been done by people and it is so possible. I want you to draw inspiration from the story of this Scottish man who did a 382 days fast. Draw inspiration so that even if you're doing 1 day fast, you tell yourself, 1 day I can do it. It's small. You understand? Draw inspiration from the story. If you're doing longer fasts, you need to be monitored. Please don't go and start an extended fast for many days and say, Dr. Adaeze said, disclaimer, if you're doing long stretches of fast, you need to be monitored, okay? So I think it would be good at this junction to mention that I have a weight loss course. It's called Fab Weight Loss Academy, okay? If you think you need some help with losing weight, you're struggling with issues related to your weight, such as joint problems or diabetes or hypertension, or you've been told you have a fatty liver, things that have to do with obesity, and you just want to lose weight, or you just want to know more about healthy lifestyles, then get in touch. Okay, send me an email at fab. So the email is fabweightlossacademy@gmail.com, and we'll be able to tell you how you can register. Okay, and the course will be starting on Saturday, the 2nd of May. So register as soon as you can so that you can get on board. It will be me and my colleagues holding your hand. We will hold your hand through the journey. So feel free to come on board. You'll be glad you did. So back to our fasting. Many people think fasting is something too tough. And in fact, they feel it's impossible for them to do. Well, fasting may be tough, especially when you're just trying it out for the first time, but it's not impossible. Honestly, it's not impossible to do. So today I'll be sharing key things that I would like you to know about fasting. Okay. Um, Number one, let's start from number one. Fasting is voluntary. Yeah, which means you are in control. You have food, but you have decided not to eat. So it's different from starvation. Okay. Number two, fasting has been done for years. People do fasting for religious reasons, for spiritual reasons, So you are doing it for weight loss and for health reasons. So it's your choice. Okay. Number three, you can start fasting today or tomorrow or anytime you want, and you can stop fasting the moment you decide to. So it's your choice. That's why it's so powerful, because it keeps you in control. You can fast a lot or fast less, entirely up to you. Like I mentioned, the longest fast in history was 382 days. So you have a long scope and stretch of days to fast. If you're doing a long fast, like I said, please, if it's more than 2 weeks, for example, you need to consult a doctor. It will be good for you to be monitored. Okay. Number five, there are people who should not fast, especially young children, pregnant women, breastfeeding women, those who are underweight. If you're underweight, why would you fast? Those who are starving, please don't fast, okay? You're malnourished, or you have an eating disorder, things like anorexia nervosa. You already have a strange relationship with food, so please don't fast, okay? So in all these cases, it might still be possible to fast, but you need to be monitored. And that's why we say get in touch with someone who can keep an eye on you if you have these other health problems. Number six, if you're on any kind of prescribed medication, please check with a doctor before starting your fast. Some medications may need to be taken with food, for example, or the dose may need to be adjusted as you progress with your fast. There are medications that reduce your blood sugar or your blood pressure, so these need to be reviewed when you're fasting. Okay. Number seven, the frequency of fasting depends entirely on you. You can fast once a week, twice a month, monthly, once a year, entirely up to you. I just love how it puts you in control, and yet it's so effective. Number eight, the duration of the fast is up to you. You can fast for 16 hours, 24 hours, 36 hours, 2 days, 1 week, and so on. You are the boss. You decide. So, number nine, you can fast towards an occasion such as your birthday, okay, or maybe fast after Christmas or before Christmas. It's super flexible and empowering to be in charge of you at last. No one dictates to you, you decide. Number 10, you can fast for a great number of different health benefits. You can fast to lose weight. Yes, you can fast to reverse your diabetes. You can fast to control your blood pressure. Try fasting to reduce your risk of heart disease if that's something your family has experienced a lot of. Fast to shed weight, to improve your fertility. In our weight loss course, at one point, one lady, she had been infertile for many years, never used contraception, been trying to get pregnant, and she just lost a bit of weight and she got pregnant. That was crazy. She was so excited, not needing medication or anything, just because she shed a few pounds she was able to take in. How amazing is that? So fasting can help in a variety of lifestyle related illnesses, okay? Can help you. Number 11, if you're feeling tired all the time, try fasting. Fasting can actually reduce lethargy. It can release more energy for you. It's a great way to improve your brain function, for example, and help you think better. So if you want to improve, you feel your brain is fogged up, you're not quite reasoning and thinking as you would like, try fasting. Okay, number 12, you will love this one. Fasting can save you money on shopping. It saves you time cooking and cleaning up after meals. You make a meal when you want to, or decide not to make a meal and fast. Your choice. Your choice. Number 13, drink what you want when you're fasting, as long as it doesn't contain calories. Your choice. Drink sensibly, okay? We don't want things that will interrupt your fast and then, undo the effect you're trying to achieve. So you can drink water only. That's the classic fast. People just drink water only. You can drink herbal teas. You can drink coffee without sugar or milk. Some people even drink bone broth. That can help you prolong your fast. So your choice. We'll talk about drinks more as we go along. So stay connected. Please click the subscribe button. Subscribe. I just want to help you. Okay? These are things I see my patients struggling with, and I've made up my mind that over the next 12 days, it's not convenient for me. It's not convenient for me at all. I'm a busy medical doctor, family physician, but I want to do this because I know it will help you. So click the subscribe button, stay tuned in, drop a comment. Let me know where you're listening in from. Let me know if this has helped you in any way. Let me know. That would be great. I would love to hear from you. So number 14, start slowly, okay? Start your fast slowly, or start fast if you want to. There's so many ways of doing it. You can start with cutting out snacks. Decide that for the next 2 days, maybe Monday and Tuesday, no snacks. You just have your 3 meals a day. You can start that way. So Monday, Tuesday, do that. Wednesday, if you're feeling well, why don't you drop your breakfast? Okay, so you're fasting up until lunchtime. Try that. Try that for the next 2 days or 3 days. So no breakfast on Wednesday, no breakfast on Thursday, no breakfast Friday. See how you feel. You'll be surprised that this is so easy to do. Okay, and if that works, why don't you cut out lunch? Over the weekend, you want to just have one meal in the evening, or however you choose it. It's so flexible, and we'll talk some more about how best you can do this. But I just want you to know that you're in control. Is as simple as that. Okay, so how does fasting work? You might be listening and you're saying, so how is that going to help me? That's why I need you to watch the first 2 videos, because I explained so much about insulin. That is what we're trying to tackle here. Okay, so why does fasting work? When you fast, you drop your insulin levels. Remember, we said obesity is due to high insulin levels, which inhibits lipolysis. Lipolysis is the burning of fat. And as long as insulin is there, you can't burn your body fat. But when you drop your insulin levels by fasting, then lipolysis kicks in. Your body finally can get all that energy trapped in your fat cells. Finally, you begin to lose weight and you enjoy the health benefits of low insulin levels. So I hope your takeaway today has included the fact that the longest ever known fast was 380 days by a Scottish man. We also learned that fasting puts you in control. It puts you right in the driver's seat of your health. And finally, fasting is a great way to treat insulin resistance and allow lipolysis, which is the burning of fat stores, body fats. Okay, so tomorrow we'll be back again. Remember, if you need some hand holding, get in touch. Fab Weight Loss Academy. Let me hold your hand along with my colleagues, and we will definitely help you to lose weight. Okay, tomorrow we'll be talking about mindset. Okay, because I know this fasting thing is a hard bone for many people to chew. So be looking at your mindset and why you think fasting is difficult. That will be a great one. So don't miss it. Thank you so much for listening. Subscribe, and I'll see you tomorrow. God bless.